All right. Last is certainly not least. I just want to, we're going to wrap up this morning with Welldoc. You may know Welldoc. You have a big history, and they've been around for a while, but I think they are an organization that's continuously evolved and really perfected kind of what they're trying to do with their digital model. So with that, Kathy. Yep.
Great. Hi, everybody. I'm Kathy Brunner from Welldoc. Really great to be here. I'm located here in Wisconsin. Welldoc is located in Columbia, Maryland. Actually, I should go back by the mic here. I'm used to wandering around. So I was saying, I'm Kathy Brunner from Welldoc. I'm based here in Wisconsin. Welldoc is based in Columbia, Maryland. And as Janet said, you may or may not have heard of us, but I wanted to start with a little bit about who we are, quick recap, and then go into what we do. So we, a couple things just on the bottom left there as you're looking. So what I find interesting about what we do, we're very diversified, and you may have used us. So we are the power behind Lilly and CVS Health, MD Live, all the various apps out there, or not all of them, but the ones I mentioned related to weight management and diabetes. So we started out as a diabetes company back in 2005. And a few of our differentiators, I have the 11 there on the top left of the screen. We have 11 FDA clearances for our diabetes product. And we have a 12th one that we filed related to predictive CGM. So predicting the future, somebody's predicting what somebody's blood glucose will be into the future. And we're really all about that, trying to be proactive versus reactive. So, and why, maybe from an employer viewpoint, are the 11 FDA clearances important? They're important because they show our clinical rigor. Basically, our messaging, our diabetes, all of our messaging, and specifically with diabetes, it's gone through the rigor of the FDA for the clearances. So someone can be assured that they're getting clinically rigorous information. And then we have, and I could share with any of you, 100 publications, now 100 plus, which would be proving our outcomes, over the course of the about 20 years we've been in business. And I wanted to talk then about the 400 plus that's indicated up there. So we have a little different approach. And what the 400 plus is we connect with over 400 plus devices that usually a member will already have. So it's a little different approach than sending a package or whatever. A lot of times people are using a blood pressure monitor, a CGM, a weight scale. They have a whole bunch of these. In fact, we hear from people sometimes that they have 5 of these sitting here, 3 of these sitting, these devices. So we find it's more cost effective, and individuals prefer oftentimes to use something they know how to work, they've worked with it. So we're gonna connect normally to the devices that they already have. And then on the bottom right, I just put something. We've won a lot of awards for our AI and our innovation. So what do we do? Oh, this one came across a little bit maybe hard to read. Sorry about that. But so our vision is really to be the cardiometabolic health leader. And if I'm sitting here as you, I was kind of listening to everybody's presentations. I'm like, there's been a lot today on cardiometabolic health. There's been a lot on AI. And so, how do we differentiate ourselves? So as Welldoc, and really for employers and what I'm talking about today, we're going to be a digital-only solution. Now, we can pair with clinical teams. And as you see those small screenshots up in the top right, we have, our main product is our mobile app, and that members, patients will use. We also have in the middle there a clinical portal. So although we're digital only, we're able to pair with clinical teams. And that might be an on-site clinic, that might be a specific other team of individuals. So we do have a care portal that some of our clients use. And the benefit to that is really that the clinicians can see all of the data. They can see everything that the member has in terms of data and manage them as a patient that way with all their specific data. And then of course on the far right, we have a little snapshot of our population health stats. Of course, we provide very robust reporting in terms of the employee population. But what do we do then? So we are a cardiometabolic platform. It's one platform for the conditions, and I'm not sure if you can see them, the cardiometabolic conditions around pre-D, type 1, type 2. We work with weight management, we work with heart failure, high blood pressure. We work with some of the specific kidney conditions. And then we build in a mental health and well-being support module into it. So a client can use the whole platform, or they can use pieces of the platform if they're, if they're supporting their members in a specific way. So parts can be turned on, parts can be turned off. But really, I would say we're a little different than the other approaches that I've heard this morning. We're digital only, and we're going to really come from the standpoint of empowering the person to achieve the goals that they're looking to achieve. So they tell us that there's a quick survey that they do at the beginning. They tell us what their goals are, what their medications are, and specifically like around weight management, we support members whether or not they're using GLP-1s. So there's different approaches. Once they tell us they're on a GLP-1, or if they're not, their journey is a little bit different. And I wanted to make a comment related to the 400 plus that I mentioned earlier. So when possible, we're going to integrate with, these are examples of partners that would be integrated into the Welldoc app. And these partners, or this integration allows people to get their data seamlessly. They don't have to do anything. So my Apple Watch, I can, it's going to track my sleep, my weight, my activity, things like that. That's going to go right into the Welldoc app. I can sign into my labs. I can, CGM. You may have noticed we partner with Abbott and Dexcom on CGM. So whenever possible, we're going to have members add the permission so that Welldoc can be just seamless. And then in other cases, they're going to report. They're going to report some of their symptoms. They're going to report their food. And we have all the easy capabilities. Of course, they can scan. Our AI scans their plate so we can tell what they've eaten. They don't really have to enter anything in unless they want to make a correction. And another example, we have geolocators, so they can send grocery lists, they Instacart. They can do a number of things seamlessly, or we make it very easy for them to input. And really then, what we're doing is, of course, we know that people use apps, MyFitnessPal, they use different apps for different things. Really our goal too is to have one place to have this data so that it can be integrated together. So people, instead of being fragmented, people can see all of this together. And of course, this helps in managing their conditions. And so this is, these are some screen samples of what the coaching looks like. And I wanted to make the point here that really the coaching is in the moment. So again, it's AI-based. So one of the advantages to AI-based coaching is it's going to pick up on the far left, and it's an acute example of low blood sugar. And the person is in the moment coached. The AI picked up, this person could be wearing a CGM or a blood glucose meter. It's going to pick up on a low blood glucose level. And in the moment, it's going to coach them on what to do and what to eat, potentially, eat of some fast acting carbs, that type of thing. The second example is the ongoing guidance. And this particular individual is on a weight loss medication. And we're going to coach them through and ask them a number of questions. What symptoms are you feeling? And coach them through, and I know people mentioned earlier, the right thing, the right exercise, the right proteins to eat, what to do. So their journey will be different if they're on a weight loss medication versus if they're not. And then we have another example of pattern recognition, because we all know AI is really good at pattern recognition. So in this case, it's another blood glucose example of a pattern. AI has picked up on the fact that this person's blood glucose is before breakfast going typically in the last week, say at 145, but after breakfast, it's spiking to 310. So in the moment, they're going to be notified of this pattern and what they can do about it. And then throughout Welldoc, we have a lot of education. And again, our approach is more self-empowering individuals to meet their goals. And so we're going to provide a lot of education throughout the, just in little snippets usually, so they can work on improving what they want to work on. So I have a couple of other examples, and I know personalization, everybody talked about that, and that is really key to the experience with Welldoc as well, in that they're not going to see any real generic information. They're going to be seeing, whether it's any of these things, their nutrition targets, recipes that they want, goals, activities, everything is going to be personalized based on, their conditions, their goals, what we know about their medications. And one example is meal planning. So we use AI. Person can say, I want meals for the next week. I want it to be this. I'm a vegetarian. I'm this. I prefer this. And we do not support or promote any specific meal program like a keto diet or others. We're gonna provide support for people no matter what, they're gonna tell us what what their meal preferences are. And they can use AI then to make their meal planning very easy and intuitive. And then again, as I mentioned, they can send a grocery list to Metro Market or wherever they are to make it very easy. We have community, so people can get support from community. They can make comments, they can get information. And we have an AI assistant as well. We call him Simon. Simon can really, the thing Simon can't do is provide very specific medical advice. Doesn't do that. But if somebody says, what's a GLP-1 or how do I pair with this particular device, whatever their questions are in more how to use the app, in more general medical information, they can use Simon to get the answer. And we're going to keep improving that because we know AI can go a long way with helping people and maybe taking some of the more routine clinical questions and guiding people that way. And as I mentioned, we support the weight management journey, whether or not they're on a GLP-1. We usually start with an 8-week journey, very specific content for each of the 8 weeks. And then I wanted to just mention one of the things we're doing that is a little different is we know that many in the medical community and many of us think, a lot of times we're using BMI as a measurement, and we know that really doesn't tell us about the person's body composition. So one of the things we're doing is body mapping. We have body mapping technology. So with my camera on my phone, I can do a body mapping in the privacy of my own home, all confidential, and we lay out the privacy policies. But I can do body mapping to let me know, what's my percentage of fat, what's my percentage of muscle, and it breaks down my body composition so that I can see specifically for me what it is and what I can work on. And we report that, of course. There's a report that goes with that. And then I wanted to highlight, these are some of the last screenshots here, but wanted to highlight, again, we're really trying to self-empower individuals with their own data. So one of the things we do right within the app is we provide a weekly report. So I can see, just looking and flipping through this area of the app, I can see what my weight trends has been, what my nutrition, my activity, all of the things that we're tracking. I get this weekly report. So again, we're trying to empower people so they can take action, so they can easily see their own data. And then we also provide a trend report. And we also take the approach of we support the PCP. So an individual can share these trends with their PCP. So we have a way they can e-fax, they can print if they want, they can get it over to their PCP so that when they walk in the office, they have specific data. And we all know how it is. You go to the doctor sometimes, it's like, how is everything? Good, good. Everybody's good. No one, has that very specific. Now, maybe it's not good, but I don't know really how to express it to my doctor, or I really don't have the information specifically on what's happening. So this allows the individual to go over their trends with their doctor. And we think that's a real advantage because it's very specific on anything that they're tracking. And then engagement and retention. And I'm just going to hit these quickly, but we have a full program too, in that it has three real phases to it. So when an employer says they want to work with us, we're going to start the awareness campaign, then we're going to go on to an engagement, and then we enrollment. And then we do ongoing engagement campaigns, because I know one of the things that has happened is a lot of times people get engaged for a short time, then they kind of forget about it or they fall off. So we're going to continue the campaigns to make people aware of this benefit. Maybe it wasn't the right timing when I saw it at annual enrollment. So later, if someone outreaches, it might be the right timing for me. So I might want to engage at that point. So we do a full and lots really rich campaign and communication suite. And then these are the engagement and retention results that we're seeing. And we think they're really high because, again, I think it points back to the personalization and the fact that if I know this is my activity, my weight, my numbers, all personal to me, I'm more apt to look at it daily, engage. So we're seeing about 30 engagements a month for people after they download Welldoc. So of course, we're seeing about 30% of those eligible in the front end, and then once they get going and they download it, it's about 30 engagements a month. And of those, about 20% are daily users. And we find, the 8 times refers to like somebody can set a goal, they can be engaged, and all of that's going to show on their home screen what they're engaged in, what their progress is. We know that they're going to engage more if they're setting goals. And then my last slide here is on our outcomes. These are divided into 3 sections here: diabetes, weight outcomes, and then cardiometabolic outcomes. And you can see, I won't read these, but you can see the different A1C, tracking A1C improvement in the diabetes outcomes, time and range. Of course, weight is mostly based on weight loss. And then we're measuring blood pressure reduction. And at the bottom, you see the numbers of the annual savings that we're seeing for the various programs. And we also do a performance guarantee. We can do 100% fees at risk. We're typically doing that with splitting those into categories like A1C reduction, weight reduction, engagement, other types of metrics that we're measuring for the employees. We'll normally pick about 5 of those mutually with the client and then guarantee fees based on those. And, I want to say also, one of the things an employer can do is, offer this at a savings, because of course we're AI only, digital based. So that's going to create a savings because we don't have the clinical team expenses, and we're still seeing significant results. So normally we'll be, maybe a 6th, a 7th, the cost of a solution with clinical. So with that, I'm not sure what my timing is here. I think I've got a few minutes if anybody has any questions.
I have a question, not really a question, but maybe just more of a statement. I heard you mention kidney as well, right? That's something that I hear you said you're all looking into helping members with understanding their kidney function as well.
Yeah, sorry, Aaron, and what was that?
Kidney function?
Oh, yes, kidney functions. Yeah, chronic kidney disease, MASH, and so forth.
Years ago when I worked in national accounts, every time I got a claims report from Northwestern Mutual, the groups I worked with, I never saw anything around kidney function. DaVita stock is going crazy high, and now 13% of DaVita patients are actually in the employer space. So this cardiovascular incidence. So do some research around, kidney health, because usually they don't get referred to their eGFRs below 30, and that's already stage 4 kidney disease. So this is going to start impacting the employer population. So I encourage all solutions, as you're talking about cardiometabolic. In 2023, the American Heart Association coined the phrase CKM. I've been in the industry 35 years. When they said that to me, I was like, I've never heard of this acronym. They are all tied together. So that's going to be an important thing for innovators, for CPAs, for payers, across the board, to make sure that we're helping people identify this condition, because usually when they hit there, the next treatment is what? Dialysis, which costs an employer about $200,000 a year. Not a big number yet, but something that's emerging, and that everyone in this room has the opportunity to learn more about and offset.
Yeah, thanks, Aaron. Yeah, definitely CKD, MASH, diabetes and pregnancies, and some of those specialty conditions, we can help them, especially manage the symptoms that they're seeing and try to help them make lifestyle improvements so that they can help that condition. Any other questions? Janet?
So, digital only and digital first, it's hard, right? To keep kind of longer term engagement. And I think in your slide, you showed kind of continuous engagement for 14 months.
Yeah.
How are you re-engaging individuals, kind of after that point, or re-engaging them, if you will? Because I imagine that, right, this journey isn't over, and I think everyone probably realizes that, right? Like, this is a lifestyle effort that is long-term, so.
Yeah, so I would say two ways. We're looking at our reporting to see if they drop off. And I don't think I mentioned, we do have like a customer care center where they will reach out. So it's not necessarily medical advice, but reach out to help people, hey, I noticed that you haven't used Welldoc in X amount of time, and just help them re-engage, find out why. Maybe they have an issue with the app, something's not working. So we do it through a customer care team, and then we also do it with those ongoing communications. So we're going to keep the communications going. I know a lot of times it's up through implementation or up through go live. We're going to keep the communications going as the ongoing, as long as the program is available. We're going to keep the communications going.
Any other questions?
You could also co-brand too a little bit, right?
Yeah. Yeah, I didn't, so we, with those partners that we work with, we're very familiar with white labeling, co-branding, single sign-on, things like that. So we have a lot of technology that we can use to integrate Welldoc into what they already have. Okay,
Thank you.
Thank you, everybody.